Hi, sir. How are you doing today?
Very well, thank you. I'm doing extremely well.
Thank you so much for joining the call. I'm really excited to have you here, and I was really intrigued with your background. So I'm glad that we could chat today. So I want to learn from your end, just for your background, like how you got started and what are the things that you're currently working on.
How I got started. That's
Yeah.
always a good question. These things, I guess, we never really know because it happens like a joke. And then the next thing we're knee deep and there's no turning back. So, entrepreneurship, I believe, is a calling. It's a calling that really you make a tough decision to make a lot of sacrifices to address a big problem in society. And hopefully, at some point, you get rewarded. But the biggest reward is that you try, right? There are no guarantees, but at least you try. And so we're quite passionate about trying to solve the question of if you have a healthcare need and you don't have money, what do you do? It's a problem that affects 7 out of 10 households every day in the Africa sub-Saharan market. And I've been looking at other markets as well, the UK, the US, and it's a problem that is also hidden in those markets, right? In the US, with the rise of high deductible plans, many people have to spend first before they can access their outpatient insurance. So if let's say you signed up with a deductible of $1,000, you need to have that $1,000 sitting somewhere before you can get your insurance to cover for something. In the UK, under the national health insurance systems, there are many people who, just because of the delays or because of their socioeconomic status, just prevent them from accessing healthcare under NHS. So the problem is a global phenomenon. And I would say maybe only countries that have a created tax base of 45% to 55% can be excluded from this definition of our problem. So we're very keen to solve that problem at scale. And it requires us to think about things from a very unconventional perspective, leveraging our expertise from a technology perspective, a supply chain perspective, and obviously a couple of ounces of compassion because it is a solution that hopefully could help millions of households access care on demand and they get a partner to support them so they can pay in installments. The credit game is good in cars, the credit game is good in houses, the credit game is good in education, in healthcare. It is pay now or you die. We want to change it to health now, pay later.
Awesome. That is really great. So can you talk a little bit more about the services that you have at CheckUps Medical Hub and how do they work in practice to meet patients' need? And also you talked about expansion. So any challenges that you faced while you were expanding and like how does it work?
Very good. Well, a solution is based on very core African values. The core African value is that in every supply chain, everybody must have a stake. Secondly, sharing is caring. Thirdly, the customer in the African market is always looking for value for money. Let me start with the last one. I don't know if you've ever, when you're in Kenya, if you ever went to the market to buy peanuts or anything like grain. So when you buy by the kilo, you be weighed by the kilo, but then the lady who is astute would say, you are my good customer. Here's that extra. She just take a hand and top up, right? Because there is that innate and inherent desire to want to say, I got something a little extra, right? You go to the bakery and you buy bread. In Europe, you buy the bread, you get one piece. But here, the person just cut, and by the way, just try this piece of bread. And that's what makes the customer happy. The sharing is caring bit, right? Private insurance says only mother, father, and child are eligible. So think about it. We have reduced humanity to the dynamic of a very, very constrained definition of what family is. That means if you have insurance, your sister cannot participate, your blood sister, your blood brother, your mother cannot participate in your premium rating. You have identified as an individual with inalienable rights, but those rights mean that you have to exclude your close family from insurance. That is the Western form of insurance. We're saying in Africa, your brother and your sister share your blood so they can share your risk as well and they can share your benefits. And then the one I talked about, the supply chain, everybody must eat in Africa. Business in Africa means that, hey, you, Swamini, if I am offering a service, you must be able to eat in that conversation. Otherwise, there's no business. So we're creating a solution whereby everybody in the supply chain benefits. The bank makes some interest rate. Obviously, we have a cut in terms of the margins from the services we offer. But then the providers in the network have to also eat. And so by creating that chain effect to everybody wins, including the patient who is saving a lot, then the solution works. So our solution is very simple. It brings together those three principles. You're sick, you contact through our platform, you can get access to a financial institution that gives you a microloan. The bank now can participate in healthcare financing and make some interest. It comes to our platform. We are able to optimize the supply chain and make a margin from operations. We are able to pass on the value of the service to the customer at cost plus margin. They save significantly. So a malaria test should be normally $6. They were able to get it at $200. Now, Swamini, is that not something that you feel the world needs?
Yeah, definitely. Definitely. I think that that's the power of entrepreneurship, helping so many people at scale and also creating value for all the people that are, involved in the supply chain, like people are able to have jobs and, feed their families in the process. So that's commendable.
So, and I'm going to take the conversation a little bit because of your investor network. A lot of people are looking at saying, hey, we want to invest in AI, right? And so the reason why I would say now is important is that problems that are solving humanity's biggest challenges need to be the ones that benefit most from AI. If the AI revolution that all of us are part of only results in unmanned cars going to Mars and automated emailing and in automated entertainment, then I believe that, yes, you can make money, but humanity's big issues need to be resolved, right? And so we want to stand as one of those companies in the ecosystem of persons who really think about the quantum leap that we can get in the healthcare sector by using the technology at hand to enhance access, to create a solution whereby people can get access to credit in real time and access to care via WhatsApp, right? Thanks to a very robust technology backend. And so we are very open to persons who are bold with their money to also be bold in their vision and how we could transform the world, because we have a clear line of sight on what every dollar can do in the healthcare system if it is managed properly using AI-enabled technology.
Yeah, that's the thing I wanted to ask. So, for example, you're also associated with Harvard Innovation Labs. So, what does that relationship look like, and how are you interacting with the US market as well? And how are you supporting the entrepreneurs that are in the US?
The good thing about Harvard is that it changes your way of thinking, where you don't see obstacles, you see opportunity in moments of crisis. And so what I learned from Harvard and the Harvard ecosystem is really a framework to really think about problem solution. We think at scale, about big things. And so I have the good fortune of having access to the Harvard Innovation Lab, which gives me access to students, it gives me access to faculty. I don't do primary research, so that aspect I don't leverage at all. But at least once every quarter, I have the chance to interact with 8 students and support them in their go-to-market strategy for the Africa market. But in that process, I learn a lot, which keeps that thinking at the highest level. So our minds are sharp and we really understand the opportunity to see where the market is in terms of cutting edge technology. Obviously, it gives me access to certain forums, which I think without the Harvard network, I would not have access to. But what remains very, very important to understand is that when you're playing in a tier 1 league, then you're attracting big money. So a lot of the ventures who are in the Harvard ecosystem are looking at Goldman Sachs type investments, top tier investments. And those are investments that typically do not trickle down to emerging market type solutions, right? So we have a lot of work to do to sort of sell our solutions upstream to the Goldman Sachs of the world, so they see that their capital efficiency is as good in the African market as also in the North American market.
And like you mentioned about the African healthcare ecosystem, I want to learn more about what is happening right now, in your opinion, and what are the things that you feel more excited about.
That's a good one. I would say, Swamini, the Africa tech ecosystem is like a ripe mango on a tree. Everybody's looking at it and everyone's a piece of it. So the question becomes, what do you do as a tech player, as an entrepreneur in that space, right? So you have to be able to go for the stars. All of us are going for that mango, but you have to learn to count small wins, right? Every step you make as you climb the tree, you kind of have to do that. Now, for me, the opportunity of going after that mango means that right now we have to leverage channel strategies of other companies to get to that mango. a lot of what we've been challenged with as tech entrepreneurs in the emerging markets is that we try to solve all of the whole supply chain. So you de-risk technology, you de-risk financing and access to capital, you de-risk talent, you de-risk customer experience, de-risk go-to-market, you de-risk customer recruitment. So by the time you are able to scale, it is literally you have gone through 7 or 10 cycles of de-risking. You understand? Now, so the name of the game now is how can you leverage other ecosystem partners who can de-risk different aspects. So right now, this whole week, the question is, who can we partner with to de-risk an element? Because you cannot de-risk it and catch up with the speed at which the market is moving. You understand? If it's de-risking payment, supply chain, risk analysis, payment, smart contracting, blockchain, we need to figure out how we're de-risking our way right to the top at lightning speed. Because as I'm talking to some folks, we have 6 months before that mango is off the tree. Payment would be so disrupted because of AI. Supply chains will be fundamentally disrupted because of AI. And patients would go to their chat GPT and talk to their doctor. They may not be able to even want to pay a doctor a shilling. So if we are not cutting edge and looking for how fast we can position a solution, we'll be obsolete in 6 months. In this environment, with the rate at which agentic AI is coming, right? Literally, our competition could be in China or India. They don't have to be geographically present here. I could literally say, I want to talk to a doctor in India, and I'll have a solution in 2 seconds. I don't need to know, I don't need to go to a website. So that means we need to figure out where competition is coming from. Competition is no longer the boots on the ground neighbor who has the same zip code as you. Competition is in a different time zone, capturing your customers while you are sleeping.
Yeah. And when we talk about health tech, I think one biggest piece of the puzzle is the government, like how they are supporting it because of all the regulations, and that sometimes stops the startups also. For example, I was looking at a startup that was using AI, like predictive analytics, to give advices to the patient. So now it's like, okay, how accurate that can be if a human, like a doctor, is not, checking the patient himself or herself. So in that regard, where do you think that the African government stand in terms of supporting the innovation technology that's coming up?
Thank you for that. That's a very important question. Government's role is important, but that's a space government will not even be able to regulate because it's happening really fast. Let me give an example. If governments are not careful, they will not have a tax collection base. The next generation of jobs will not be one that is taxable through the regular fiscal structure. I am talking to guys who are building payment systems that are using agentic transaction in real time, and they're using crypto. So the government of Kenya this week just passed a law where they're trying to tax 3% because they see it coming and they can't stop it, right? But then now, what systems do you need to put in place to be able to tax crypto? At what value? Against which stable coin? So we're getting in uncharted territory. It's almost like at first, governments used to tax a ship when they docked at the port of a country. That was the main way governments made revenue. Then the internet came. The governments are barely catching up with being able to track transactions online. And to do transaction online, you had an extension .com.ke or whichever country you were in. There's no .ai.ke. There's no .kai.usa. And being in a room whereby guys are saying organizations that have traditionally done cross-border payments would be obsolete in 6 months. That's a bold declaration, right? That means you're putting Visa, MasterCard, UnionPay in checkmate because of the borderless environment which you're operating. Your child can be in the US and take classes in India, can take classes in Canada, in Australia, on their own terms and have a degree. That is valid. So when I hear the question of government, I say basically what governments have to do is literally go into the deep tank and think about their future in a year or 2. Otherwise, the wrong persons would pay the price. That means those who are on the ground, small businesses, mom and pop shops, are the ones who are going to pay the price. Those who are in the ecosystem would be flying high. Then the question of inequity comes in. How do you deal with such inequity? Where the guy who has 1,000 agents trading for him and the mother in the village who has no agent trading for her, how can you compare those two? Governments will be forced to tax the lady in the village, and the guy in the cloud will be left flying high. So that's what we're looking at. And so in one of the meetings, there were 60 of us in the room, the Trump administration had 22 of 60 people in a room. That's how seriously they're taking this issue. So despite the pomp that you might see on TV, this issue is one that could be elusive overnight. The arms trade is no longer relevant. The nuclear trade is a distraction. Petroleum trade is a distraction. The question is who controls data and the lobbying that is happening to make sure that Anthropic, their database, Gemini, the database for Google, the Azure, the cloud database for Microsoft, IBM, their cloud database. That is where the world is. That's the real competition. And now China says we must have our own database because the data you have trains your models to opens up the world. So if you lock your database to the world, you lock opportunity. Then you think about the rest of the global south. There's no database at scale. So how do we create systems that trade? But the good thing about it is that the strategy is called 5.5 billion people transacting. So that means the global south must be on cloud, on the Anthropic database. The global south must be on the Gemini database. And so you're going to see a shift where there will be a lot of perks, even free phones that are being given to the global south to make sure they participate. Because the name of the game is now $1 trillion valuation. To play in cloud, you must have $1 trillion valuation. It's not unicorn status. So I'm just trying to share with you the sheer magnitude of where we are. And these are issues that even the foreign departments are not discussing. So we on the startup ecosystem, we have to be ready for that change. And it may mean very significant retooling of our workforce to focus on creating connections with our customers, because a lot of the things that we used to do as value add no longer exist. Somebody wrote an article the other day, that any government that pays McKinsey for a consultation report is stupid. It's a waste of money. Can you imagine? Who would have said that a year ago? Because any serious government can generate a report in 2 minutes to the same extent as McKinsey. So you need government advisory. So McKinsey would have to be an organization that also not only brings intelligence, but brings the human relations into the equation. They may become the new agency for diplomacy. That is the kind of thinking that we have to really be clear about as we're going into this new era.
Thank you so much for sharing that. So looking ahead, how do you envision your company's role evolving within the African healthcare tech system over the next few years?
I think it boils down to really staying very clear about the problem we're solving. If we are not, we lose. And so it may be premature to say we have it because we are literally just understanding the sheer magnitude of the groundswell. However, what I can say is that as far as healthcare is concerned, AI does not put a pill in the mouth. AI does not collect your blood sample for the tests. So you still need a supply chain that is able to deliver medication and collect that blood sample. That is guaranteed, right? But then the question where the cost structure of healthcare will change dramatically, because at first you need one doctor to see 20 patients a day. You can have a doctor literally see 1,000 patients a day because he has agents that are analyzing his cases, booking appointments for him, doing his surgical reports. So it becomes basically the name of the game is the number of agents you have in your operations will determine your operational efficiency. So you could have literally an agent on the call center, an agent in finance and billing, and claims management, an agent that is helping you plan your day. So all you did is one nurse to help you give you the tools and to move the patient from the bed onto the table for surgery and to move the medication from the counter into the syringe. That's kind of where we're getting into. From a leadership perspective, we kind of have to zero in on where is it that we need human cost and where can technology take over, because we have to be able to compete on price.
Yeah, price is a big thing in emerging markets. Like even in India, everyone is just competing over price. So thank you for sharing that. Just to wrap up this interview, any final piece of advice for the entrepreneurs that will be creating new startups or any investors that are looking to invest?
Every advice is that time right now, everything that we know has changed, right? So if somebody comes and says, oh, I need 2 weeks to get back to you, think twice and say, maybe you should do it in 2 seconds. That is really the leadership challenge that we need to have in this stuff, right? Because I was at the London Tech Week, I met an investor. He says, your data is my IC, is my investment committee. You load your data, in 2 minutes you say, can we invest in your business or not? They don't have to ask you questions like, oh, we're sector agnostic. No, it's a business. Can you move money 2x faster in a 3-year timeline. And it is not a pipe dream because one of the companies I also met, this is a 28-year-old guy. He started his company October. He exited at $80 million within 8 months. So we are coming from a place where people are saying we do deals over 9 months to where people are starting and exiting in 9 months. Time is no longer money. Time is oxygen.
Well, I'm really glad that you could join us today and shared all your insights. I'm very sure like it's been super helpful for me. I'm very sure it will be super helpful for our viewers as well.
Well, thanks for having me and looking forward to any follow-up questions or communications.
Yeah, definitely. How do you like people to reach out to you, by the way? Is LinkedIn fine or how do we do that?
LinkedIn is the best.
Awesome, awesome. Thank you for your time today.
You bet. Thanks for having me. Bye for now.